meeting proper. There was a clue in what I just said. So the meeting is being recorded. It will be published on the CCG's website. Second thing is, Michelle's confirmed for me this morning that we haven't got any public questions this time round for us to consider. We've just spoken about Nigel. I'm sure that we all want to send him our very best wishes and complete bless him. We've got Fiona Phillips with us this morning because Sharon Stoltz can't attend on behalf of the City Council. So welcome, Fiona. I understand you've got to leave around about 11 o'clock.
Yes, unfortunately I do. Thank you.
Okay. All right. And then just so that people get time to manage their disappointment, Helena's also going to have to dip in and dip out this morning. So bless you, Helena. I'm sure you'll contribute fully while you're here. Okay, declaration of members' interest in the business of the meeting. If anybody's got anything to declare now, please shout up. If not, then if anything arises during the course of the meeting, shout up then and we'll deal with it there and then. Item 3 then, we've got 10 pages of minutes from our meeting held on the 2nd of December. Does anybody want to raise any queries on those minutes or point to any inaccuracies or incompleteness in those minutes? That'll be a first. No? I'll take silence as that people are happy for those minutes to be signed off as an accurate, complete record of the business we transacted on the 2nd of December then. Matters arising from the minutes then. We have a small number of them. Most of them, I think, should be picked up in later items on the agenda. The patient story matter arising isn't due until the 5th of March. We've got 2 related to the continuing coronavirus pandemic, one under patient story and one specifically under the COVID-19 update. Does anybody feel the need to give any updates to governing body members this morning, any of the execs, about the continuing COVID-19 pandemic?
I think we'll come through in the reports and our conversations, Phil.
Okay, thank you. Then there's 2 other items. The report on safeguarding priorities. I assume, Michelle, that you'll pick those up under item 10 today.
Yeah, I can give you a quick update on that because you haven't got something that we can talk about, but it is in progress. So in summary, the ICS has agreed to a ICS transitional lead until September. And she's called Julie, and she is doing a great job at making sure that we will be ready for the new ICS governance around safeguarding, which will also satisfy the requirements of our statutory requirements and also the requirements from NHS England. And what's happening is that she is describing what that is. It's been signed off by NHS England, but what it actually means in practice and giving the Safeguarding Adults boards and children's partnerships assurance that they will get the same level of health input is the really important bit for us. And so that is ready to go and do the rounds of the safeguarding boards and children's partnerships to get their input and an agreement and discussion around the future arrangement. So I will bring that back next time. The other thing is it's dependent on that being approved by the incoming ICS Director of Nursing, and I'm in conversation with her to get that signed off too.
Okay, thanks, Michelle. Sorry, Phil, did you want to come in? No? Okay, well, stay with you then, Michelle, for the final matter arising. The Quality and Patient Experience Report is item 6 on today's agenda, and I assume that you'll deal with this matter arising as part of that.
Yeah.
Okay, lovely. Thanks. Phil, then, we're with you. Item 5, Accountable Officer Update.
Thank you. Morning all. A verbal update from me in the governing body report on how we're managing risks. I'll go through the statutory reports that we'll hear later. So I'll talk predominantly about the transition. So governing body colleagues and members of the public watching this recording will know that the legislative timetable has now slipped, and it is proposed that CCGs will now continue until the 30th of June. We're still working through the consequences of that, but that includes our continued support to staff in every way that we can. That includes trying to finalise what we think our plans would be for redeployment of the CCG staff into the new arrangement where there'll be a locus upon place. So for North Yorkshire and for York, we would hope to have those proposals finalised in February. That should offer reassurance and clarity for staff, but we will still have to agree that with other parts of the new NHS infrastructure, including, of course, the ICS itself. So work still to do there, but we're doing what we can, really conscious of how important that is to our staff. We're continuing with the due diligence work around the close down of the CCG. That's sort of deferred in some ways, in that we now have another 3 months to work through. So it feels as though we made a good start. We're aware of the issues, but now some of that work is progressing at a different pace as we start to think about the 30th of June. But Abby and others through the deputies group are on top of that, and in due course, between April and June, this governing body will, of course, receive an update on that in some detail, and where appropriate, that'll go through our committee infrastructure. The governance arrangements for this CCG and for the ICB, so the ICS's new board, the governance arrangements are being worked through at the moment. They're close to finalisation in terms of the proposal. The extent to which that reaches a conclusion will probably determine how often this governing body continues to meet in public session. There should be an update available for governing body in public session when we next meet. There are proposals that suggest that the governance arrangements that we have enjoyed this year and in previous years will be revised to some extent. So important that governing body are aware of that and have the opportunity to discuss that, which we will be doing later in private session. So that's where I'll stop. Thank you, Phil, but happy to take any questions or comments about any of that. Thank you.
Okay, thanks, Phil. There was some talk of the existing bodies continuing for up to 6 months, not 3. Has that now gone, Phil? Is it now firm that it's a 3 months extension of life for the existing CCGs?
It's 3 months. There's lots of talk and lots of speculation. Some of it informed speculation, much of it less so. It will be determined by matters that go beyond our local control.
Sure.
And so we proceed on the basis of what we know.
Yep. Okay. Thank you, David.
Yeah, Phil, could I just ask you again? What's your best view about when staff will actually know with some certainty what's going to happen to them, what they're going to be offered and where they're going to be? When realistically could staff kind of sit back and rest and say, I know what's going to happen to me? Because it must be very, very disconcerting for our staff at all levels. So do we have a better view on that? Because that is something that we expressed concern about at the last Finance and Performance Committee, as you were aware. So when will people be able to rest?
Yeah, good question, David. Thank you. So mid-February, we should be in the CCG close to finalising our proposals in that respect. and sharing them in some form shortly after that with staff, but in the context of that still being a proposal. We would hope then by the end of February to be firming that up and be in a position then to share that with colleagues across the ICS. So the ICS executive and its board members themselves will have a view on what sort of infrastructure they want for the ICS, and that of course impacts on how many people would operate at that level compared to place. So there's a conversation to have with them about that. Equally, the establishment and the formation of provider collaboratives will require both managerial and clinical support. So we will also have to make sure that we're having a conversation with the representatives of provider collaboratives so that they are equally content with how the redeployment of all of our staff is shared across place, across provider collaboratives, and equally supports the work that the ICB it will do itself, with an eye to what we might see being carried out at a North Yorkshire and York level, if and when that adds any strategic benefit, and that's a factor to also consider. So it's not something we can do on our own in isolation, but the work that we can do on our own with a view to all of that, we should have concluded and have shared with staff by the end of February. We'll have those other conversations through March, but by the end of March we should have hopefully resolved all of that so that these new arrangements can start from April. So that's the position, David. Hopefully that will fall into place for staff and make them feel better than they do now.
Yeah. So could I ask Phil, it may be too early to say, but what kind of processes are going to be in place, HR processes to support people who are unhappy with the result of our reorganisation?
Not yet clear, David. So there was a consultation exercise carried out at the end of the last calendar year that related to the establishment of the Integrated Care Board. There has just started a consultation exercise that relates to the staff, the officers who don't have the employment guarantee. So that's the directors of this CCG and of other CCGs. That consultation exercise started last week and runs for approximately 3 weeks. That'll then be followed by a next phase, which at that stage will actually impact on the directors themselves. In this first phase, it's just for accountable officers. The period that second phase runs has not yet been agreed. After that, there'll be a further phase which will relate to the broader group of staff, all of which have had the employment commitment. But how that will be managed in terms of any concerns or appeals that any of those members of staff will have has not yet been worked through by the ICS, who are managing that part of the process.
Okay.
Part of the difficulty, David, in and for this governing body in all of that is that although the overall process is being managed by the ICS, they of course, up until the point at which there's no CCG, they continue to be CCG staff, and therefore the legal liability for ensuring that good practice is followed and that any issues are resolved in the way that we would want them to be, the responsibility and liability for that rests with the CCG and this governing body. So it's not straightforward.
And I think that probably, Phil, rehearses a conversation that we'll have over a number of issues in part 2. Can I just follow up David's area? Have we seen any significant attrition of CCG staff, either in terms of key post holders and or in terms of number of staff that have elected to seek employment elsewhere?
Yeah, we have particularly in the last month or two, as have all CCGs.
Yeah.
Michelle, do you want to just respond to that? But equally, Simon, Denise, Steph, if you want to add, please do.
Yes, I would agree. They're not vast numbers, but they're often in very key areas. So we are seeing that, and we're seeing therefore a lack of ability to respond to business as usual and the support that we give to the system. But because the system is so pressured, people are being asked to go above and beyond what they'd normally do anyway. So the existing staff are under significant pressure too within the CCG. And we've got a lot of people, well, a significant number of people for our total headcount that are on secondment for temporary periods of time. And then it's hard for you to backfill that, knowing there's uncertainty around the corner. And then there are ICS processes in place to recruit to any posts. And so some of that's taken out of our hands in terms of permissions. And that sometimes takes quite a while to resolve. So all those things added together means, we are really feeling a lack of capacity.
Okay, thanks, Michelle. Any of the other execs want to chip in there? No?
I can give some detail, Phil. The finance team contracts procurement have been pretty stable throughout, and we had a plan in place to manage staff departures such that we were going to be able to complete our accounts for the periods 21-22. That's still in place. The extension by 3 months has meant those plans are no longer good enough to secure accounts being capable of produced for the Q1 period. So that's just 2 people, but 2 people who leave in those critical posts really does scupper our capacity. So we'll have to work on other areas, on other capabilities.
And there's a hiatus of activity in the finance team around the year end anyway, isn't there?
Year end, close down, setting up the new organisation, and you've got things like internal audit all over everything, trying to make sure that it's all happening in a sensible process, planning happening at the same time. So significant pressure and fewer and fewer people to do it.
Yeah. Okay. Thanks, Simon. Julie, you've had your hand up for a little while. Then Steph. Thank you.
Is Steph's part of this conversation, because mine's stepping back a bit? So if I let Steph go first.
Yeah, I just wanted to reinforce the point Michelle made about secondment, because I think traditionally you'd imagine a secondee going to another organisation. But of course, in a period of transition, what we're seeing at the moment is key members of staff fulfilling dual roles. And the theory is that you have a split week working, but actually that doesn't actually reflect what's happening in practice. Key members of staff want to support the transition, want to make the structures of the ICS work, and therefore they are taking on more and more responsibilities. And of course, as we have this shifting end of the CCG, more and more work is coming to the CCG to lead and be responsible for. So without that sort of clarity between new roles of place and what the collaboratives will do, staff are just being all things to all people, which is a testament to them and their commitment to their roles, their colleagues, and the values that we see them living every day in their workplace. But it doesn't come without personal toll and personal impact.
Okay, thanks, Steph. Julie?
Thank you, Phil. Phil Metten, this is taking us back to place, really. We know that it has to be approved, that our new way of working for our colleagues has to be approved by place. How reassured are we that actually we've got that right? Have we been able to have any conversations with anybody?
Thanks, Julie. So there's probably two answers to that, one for each place. So for York and the emergent alliance that we've been working on for about 9 months now, that body of people had a timeout last week, to which the designate chair and designate chief executive of the ICB were invited and joined. They were reassured and they were positive about the alliance and how it will work in tandem with the ICB when established through some form of governance, which we would anticipate being a joint committee arrangement. So for York, I think we're as confident as we can be and should be at this stage about that, but more work to do and important issues still to be clarified about some of the detail. But so far, I think we would be as confident as we could and should be. For our part of North Yorkshire, we are less confident and less clear. That's in part because of the complexity of North Yorkshire and its constituent places, and equally they've probably not had the focus on this for as long as we have had in York, so they're a little bit behind, and we don't have direct control over the shaping of that, or indeed the pace at which that moves. But what we are doing is offering our support to that, both indirectly through advice and involvement, but also directly through some of our staff. So Fiona, for example, working directly into the development of what's happening in North Yorkshire. So less confident and less clear about that, but they will be working to the same overall timetable, so that they have work to do.
Thank you, Phil. It was just for me to get that little bit more of reassurance for our staff, who we've talked about a great deal this morning and are hugely concerned about their well-being. And I just think the more we know, the more comfortable that they're going to feel.
Sure. Yep.
Thank you.
Thanks. Okay. Any more on this item? No. Thank you. Good set of questions, and thank you for the openness and honesty with which we've got answers. That on its own brings us assurance that we're being kept in the picture as much as we can be. Thank you. Okay, moving on. Item 6 then. We're in your capable hands, Michelle. Quality and patient experience report.
Thanks, Phil. So I suppose the key message really out of this report, just for context, is that this report went to Quality and Patient Experience Committee before Christmas. And so quite rightly, from a governance point of view, you see a version of that here. But the key message is that the pressure within every aspect of the system has increased significantly since this report. And people are running on empty, and I commend people that continue to work in such a pressured system. And it is every part of the system, health and care, and the voluntary sector included. We are seeing some extraordinary things we've not seen before, such as people waiting on trolleys for 30 hours on occasion. We have seen 460 some 12-hour trolley waits in January in York and Scarborough Hospital. we are seeing increasing demand all over the system. We've still got significant sickness from staff, of which a large proportion, nearly half in some areas, is related to COVID. The isolation rules as well, and when you can get back to work, but also there's isolation rules which mean that a care home, if they have an outbreak, is closed for 28 days to admissions, is significant in terms of the lack of capacity. That's recently been changed back down to 14 days, and we are starting to see the care home market open up a bit more. The other sort of bit that adds to the perfect storm is the acuity of patients. We're seeing patients that are much sicker as well, and that will be a direct impact of COVID and waiting for other health conditions to be attended to and not being able to access services. So it's really not great. In terms of what we're doing, really strong partnership working, very significant number of gatherings to try and mitigate and add capacity to the system. And I think what we can definitely see is really improved relationships on that front, people pulling together to try and do the best thing. Been on a number of discharge meetings yesterday, the day before. The York Hospital is undergoing a series of events supported by ESIST around discharge in particular, and seeing what the learning is and could we do anything differently together as partners. The mandatory vaccination for care homes became law in November, and we've talked about that here before, and therefore the subsequent number of staff that meant left the service because they were no longer able to be employed in those care settings. And I think that we can see that vaccination protects patients and staff. We can absolutely see that, but of course the impact was that people lost their employment, and then some of those people moved to areas where you didn't need to have mandatory vaccination, and then of course we got the edict that the mandatory vaccination second round of regulations would come into play very soon. People have worked their socks off within organisations to try and apply the regulations and the definition within the regulations, but it would have meant that more health and care services would have lost staff. And then, of course, you will have heard in the last day or two that's been revoked by government. The word is revoked. We're still not quite sure yet whether that means there's a delay. It's going to be delayed, or whether it's going to be completely shelved, and we're waiting for some communication about that. But what's very clear is that we must not give letters of dismissal to any staff at the moment. So that's helpful in one sense and not helpful in another, because the extraordinary amount of work that's gone in to try and apply those regulations and the relationships that has caused strain on within organisations in order to apply that, and the suffering of staff because of that. What we're trying to do in terms of supporting the system is a huge number of things, and we can always bring back a sort of summary of what we've been doing if that helps. They'll be learning, and some of it's like in the moment stuff which you wouldn't necessarily want to do, and others is how do we get out of this in the future, and how do we have a more strategic approach to some of the things that they're struggling with at the moment. We're certainly absolutely trying to resist putting tents in car parks and temporary arrangements like that, but we might have to put some patients in hotels with very good support. You know, no idea is off the table at the moment because of the pressures. We have just passed the 1-year anniversary of the COVID vaccination programme. It seems to have been, sometimes it's only feels like 2 weeks, and sometimes it feels like we've been doing this for years. But of course that increases the resource intensity, certainly within primary care, who have been magnificent in the administration of this. And it has reduced deaths, we can see that, and harmed people, but COVID has absolutely not gone away. And I'm sure Steph will come in and give us some more context to that. Booster programme is still being rolled out, and numbers increasing, and we've just started, or about to start, the 5 to 11-year-old cohort where those children are deemed vulnerable. So I don't know if at that point, Steph, if you want to come on in, or Fiona wants to come in terms of COVID and how things are, we can kind of roll 2 items into one.
Sure. Steph, Fiona?
Yeah, may I just want to share my screen, because at this point I normally throw lots of numbers at you. But I think one of the things that I want to highlight, we obviously are now counting first and second doses and boosters, and the picture is good in terms of numbers, but what we can see is take up dropping off significantly. So that top graph shows that when the booster program really ramped up during the month of December, providers did a phenomenal job. On one day they did 8,000 booster vaccinations on one day. Absolutely phenomenal, and really good take up into January. But in the context of our conversations about demand, staff who are isolating because they or loved ones are unwell, we're starting to hit that point where we need to have the conversation about how we consolidate our offer around vaccines, and we absolutely want to encourage people to come for a first vaccination if they haven't to date. But continually staffing clinics where we're getting 10%, 15% of appointments taken up is something that isn't sustainable for much longer. So I just want to highlight that list of numbers start to show the sort of vaccines that we're doing on a daily basis. So and it's reasonably unpredictable. Who would know on the 29th of January that we were doing 800 in a day, and then only 2 days later it was 164. And we could do some work around that, weather, whatever else is going on. But we continue to be focused on our 3 wards where take up is low, or certainly lower than other areas. So and that's been a recurrent theme for us. So we've put services into specific areas. So there's a pharmacy provision in Fulford. We're going to be running additional pop-up clinics at Yorkshire Gillygate practice in February, and we also have a pharmacy offer at Monk Bar. So it's just to say that the global numbers are big, but it does hide continuing concerns of areas where we think and we want to extend the offer to more people. But as Michelle saying, the vaccine programme continues to be just a really great success story. So thank you, everyone.
Absolutely. Thanks, Steph. Fiona, anything you want to add?
And I think it would probably just be useful updating you in terms of some of our response to COVID and really what we're going to have to be doing over the next 2 months, really. So you'll probably be aware that local authorities were given the Contain Outbreak Management Fund to support that kind of local outbreak management. That funding runs out at the end of March. So a lot of the work that we have been doing around outbreak management, we're now having to start to wind down. So for example, our local contact tracing team who've been following up all cases of COVID and doing the contact tracing, we will have to start winding that down, and that will end at the end of March. So that may mean that between now and March, similarly, we will have staff whose contracts will end, and some of those staff may start to look for alternative employment. So we may have to move that local contact tracing service to a different model of perhaps not following up all of our cases, but handing back some of those to the national team. The other sort of significant piece of work we've been doing around outbreak management is around access to symptom-free testing for the population and having test sites. So again, we will have a programme of closing down those test sites, and probably what we'll use the next couple of months to do is more of the outreach work. So like you said, Steph, you know, having people sat in test sites, if people aren't coming forward so much, what we'll do is we'll do more of the people actually just going out to people's doors and making sure that people know how to access test sites. And on the back of that as well, what we also do when that team are out is we let people know where the vaccination clinics are as well. So we'll look to support doing as much of that as possible from now until the end of March. But then after March, we won't have that resource to do any of that work unless between now and the end of March we are told we're given any more funding, but it's looking unlikely at the moment. Okay,
thanks, Fiona. Any more on this item then? Comments, questions? No? Item 7 then, I think we've largely dealt with this, Michelle. Is there anything you want to add under item 7, the coronavirus update, that we haven't already just dealt with?
No, but I was just going to come back to a few things from the Quality and Patient Experience report, if that's okay. No, that's all right. Cool. I just wanted to highlight some positive things, really. It's not all doom and gloom. So some of the mitigations that we're putting in place are really good, and some of the initiatives that people are doing are really good. So, you know, Dementia Forward as a mitigation for caring for people who are waiting is a really good initiative, and the feedback from patients and their families is very good, and we've always thought very highly of Dementia Forward. The retreat's been awarded the ADHD and autism contract, and although the waiting list is still very long, we expect to see that continue to reduce, and they come on board in April. I wanted to commend our practices really for the significant increase in the health checks for those with enduring mental illness, and there are detailed in the report those practices who've made a significant difference to that, but SHA in particular, who've been asked to sort of show and tell the ICS how they've managed to do that, and spread that good practice. The Safe and Well reviews, these are reviews that are mandated as a one-off for all vulnerable people that have an LD diagnosis who are living in hospitals. And it comes on the back of a Norfolk Safeguarding Adult review into Corston Park, where it was found that the usual oversight arrangements for these individuals wasn't robust enough, and they came to harm. So we have been asked to do an additional Safe and Well review for all of those people in our care. And for our CCG, it's 8 people. Across the ICS, it's circa 70. And that changes because people come out of hospital and some people come into hospital and the numbers change. And what I would say in terms of increased ask for people who are already really busy, although we completely sign up to the ethos of doing this check, is that the CCGs already do a 6 to 8 week review of all of those people, and this is in addition to that. And the significant amount of work that it takes to do it takes at least 8 hours in total to have the conversations, to do the paperwork, and then about another 3 days per case to get ready for the ICS panel, which then gives you a degree of confidence or not over whether those people are safe and well. And what I would just say is that our case managers that have presented the cases so far have been highly commended for the job that they've done, and a great level of assurance that was given to the panel for that. And I just wanted to highlight that because it's just been great to see. In the SEND bit of the report, I wanted to highlight the transition nurse that we commissioned into York Hospital. We can bring some more detail back, but on page 29, what we're really seeing is since that person was in post from last June, who we've never had a post like this before, who's absolutely concentrated on those children that go into adulthood but are still counted as SEND, because SEND is from 0 to 25, and how we all know that transition is a very tricky time for people. So this person has concentrated on that cohort of people in transition as making a real difference to the experience that they have and the success of their EHCP. So I wanted to commend that too. There's lots of really good learning there. Internal audit, you might remember a couple of years ago did an audit of our community paediatric services, and we got limited assurance, and the work of Karen McNicholas together with Salcati, particularly at the hospital, has changed that around to get significant assurance. They've done some magnificent work there in that service. 0 to 19 service that's commissioned by and in-housed by City of York Council. They commissioned that back in-house in 2018, and this is the first CQC inspection that they've had of that service, and it's come out as overall good. Really good report to read, some really good things in there from what was a really struggling service to some really, really great aspects of care there. And then we just move on to the risks, and I hope that you can see that we've probably talked about most of these already. Maternity in particular, is struggling as much as any other service, but we want to do a deep dive in QPEC on that, and that's going to be in March now, so we'll be able to bring back some more detail. And that's all I was going to say.
Thanks, Michelle. Thanks for that comprehensive update, and bless you for trying to rebalance things with a few positives. Any more comments or questions for Michelle or Steph or Fiona, colleagues? No? Okay. So as previously agreed, I think we've already dealt with item 7, the coronavirus update. I'll just double check. Anything else that needs to be raised on that, colleagues? No? Okay.
Helena's got a hand up.
Is it all
Sorry,
right?
Helena.
I just wanted to reiterate what Michelle said about dementia support and vulnerable adult support, particularly learning disabilities and SMI, and how important that is. But a lot of people are talking about cognitive deconditioning, and we're really worried in COVID recovery that we're going to uncover an enormous amount of delayed presentations of cognitive deconditioning, i.e. mild cognitive impairment progressing to dementia. So just wanted to highlight the roles of the dementia care coordinators and Dementia Forward, as well as Michelle, and just commend them for everything they're doing, because they're really holding people whilst there are those big long delays in the system and lots of fears around coming to see us in practice and everything else. So just wanted to reiterate that.
Okay, thanks, Helena. Okay, so that's the 2 for 1 on items 6 and 7. Colleagues will know that we haven't, as usual, got the board assurance framework paper in with ours for today. I had an exchange of messages with Abby yesterday. Unfortunately, her team has been hit very hard very recently by COVID. Abby could have produced a board assurance framework very last minute for today, but it would have been incomplete and not up to the standard that either she or I would have wanted. What we've agreed is that following next Tuesday's deputies meeting, Abby will update the board assurance framework and circulate it to all governing body members. I have, however, yesterday and this morning got assurance from Abby that there are no new issues raised within the board assurance framework which would have had to been specifically discussed by governing body members this morning. It would have been very largely an item for noting. So we will get the board assurance framework paper from Abby, but it'll be after Tuesday next week. I hope that's okay with colleagues. So we move on again. Back to you, Michelle. Item 9, the Nhs People Plan.
So this is your regular update on the People Plan, which is required to come to governing body, and I hope you can see the highlights there in orange. And it really highlights what we continue to try and do for our staff in terms of our well-being and OD offers, flexible working, meaningful conversations about their futures where we possibly can, given the previous conversation we've had, and making sure that inclusion, equality and diversity are really high on our agenda. So it's an update on the People's Plan there, just to note, really.
Okay, thanks, Michelle. Colleagues, any comments or questions for Michelle on the People Plan? We have had some discussion already on this. No. Well, we're making good headway. NHS North Yorkshire and Vale of York Safeguarding Adults annual report. Back to you, Michelle.
Thanks, Phil. It's to note, and as you can see, as the annual reports get written and get processed and then do the rounds of the boards and different governing bodies, you might think it's not that contemporaneous because it's a 2020-21 report, and this is a safeguarding report for the designated professionals that we employ. So it's not the work of the boards, it's the work of the people that we employ, so the designated nurses and designated doctors. And it's the first one since CCG became the employing organisation of those individuals, and we work across that footprint together, although we have nominated individuals that work on our patch in the main, but in total it's the fourth report. And it summarises really the arrangements that are have been put in place, the work that they've undertaken, the changes that have come about during pandemic, and the progress against those strategic priorities. On page 67, you can see the key challenges and priorities for the next coming year. But of course, it's an important report in one sense because it describes the work during COVID, the year of COVID really in 2020-21, and what people have tried to do to safeguard adults and children across the patch. So it's to note.
Sure. Thanks, Michelle. Despite that, any comments or questions from colleagues? David?
Yeah, just to say, I mean, as Michelle alluded to earlier, I mean, this is a really, really important area.
Yeah,
and I think we do need assurance that staff are still in place to take this forward, because I think this and, for example, you know, health issues for children and young people, mental health issues, are often things that fall by the wayside when we're consumed with organisational matters. So I think the assurance that Michelle gave us about a new member of staff earlier is something that we should monitor, because this is a really critical area where people can be, I think, very badly disadvantaged. So thanks for the work on that.
Absolutely. Yeah, thank you. Okay, item 9, we're with you, Simon, then. Financial performance report. This is the report that went to the recent Finance and Performance Committee, but you're going to take us through month 9. Thanks, Simon.
Yeah. Do you need me to fill this out for an hour, Phil?
No, just talk at normal pace.
Okay.
I'm sure that we've all got busy enough lives that we, if we do finish early, that we can find something meaningful to do. Okay,
thank you. So this is the report to month 9. Summary position is CCG finds itself slightly ahead of plan, £350,000 better than we thought we would be at this time of the year, but we're still forecasting that we'll hit our plan and break-even position. So that's good news. I would characterise the rest of the year as low risk. So as long as nothing, really out of the ordinary happens, this is what we're going to see when we get through to March and April. The position does depend on national monies coming in. They're noted in the report, the hospital discharge programme, elective recovery fund, etc. We're well used to those arrangements now. So again, low risk in terms of the overall position, although it's quite a large amount of money in terms of the full year position, so £6.8 million still needed, but again, characterising that as low risk. See in section 4, there's still quite a significant number of allocations coming through on a month-by-month basis. Significantly amongst them, £1.5 million given by the regional team to support frontline social care workers with effectively an enhancement to their salary. That's being coordinated by our local authority and across the northeastern Yorkshire to make sure that we're putting money out into trying to stabilise social care workforce. And in section 5, the CCG continues to exercise good financial discipline, so balance sheet is looking fine. Better Payment Practice Code. This is the requirement for the CCG to pay its suppliers on time. We're hitting that target, and we're also managing our cash position within the expected limits. So all considered, all looking good at month 9 and expected to continue through into the rest of the year. No concerns, particularly with the accounts for 21-22. I've got a meeting with External Audit to discuss that tomorrow. As noted earlier, we're yet to land a plan for how we produce the accounts for Q1, but we're working on it. We're not hugely concerned. It will be mutual aid from other CCGs, I would imagine. Thankfully, those accounts aren't going to be audited until the end of 22-23, along with the overall ICB accounts. So that will place a good degree of emphasis on the quality of the working papers, because people might have moved on by that point. But our working papers have been praised by our external auditors over the years, so nothing particularly to worry about there. Thank you, Phil.
Thanks, Simon. Well, I want to, for the record and the recording, want to repeat the comments I made under David's chairmanship in Finance and Performance Committee. Having had some 18.5 years in a seat in policing that was pretty similar to yours, Simon, I have to say that given the turbulent air through which the CCG has been travelling for the last, well, 2 years, but certainly the last financial year, the tolerances to which the annual revenue budget is being delivered, in my professional view, are nothing short of remarkable. And I think that that doesn't just reflect on you and your team, the finance team, and the specialist knowledge and experience that they bring to the piece, but it's a good window into all of the activity across the CCG, and speaks volumes about the skill, experience and dedication of people right across the organisation, because the accounts hold a mirror up to the organisation, albeit one with a pound sign on it. So my thanks and congratulations to everybody for that picture that's being presented. Colleagues, any questions or comments that people want to raise? No? Well, we continue to make good headway. We've got a number of received items from 12 to 16. I don't propose to go through them, despite the headroom that we've earned ourselves this morning, page by page. But I'll just go through item by item and just see if anybody wants to raise any comments or questions on any of the reports that we've got and had the ability to read. So, the executive committees. Anybody want to raise any questions or make any comments on the executive committee papers that we've got? No. Finance and Performance Committee, we've got two, 25th of November and the 16th of December. Any comments or queries on those?
Could I just say, Chair, that
sure.
That we, we're trying to discover our role as we move forward towards the establishment of the ICB, but essentially we are concerned to try and look after the interests of staff as far as we're able, and to continue to give assurance, as you've just described, that we are meeting our requirements. We have to say that we do have some concerns at the moment about how things are emerging, and that will be the subject of further discussions.
Yes.
But we are trying to keep a watching eye.
Yeah, okay. Thank you, David. Item 14 then, we've got the 25th of November report from the Primary Care Commissioning Committee. Questions or comments on that? No? Penultimately, the Quality and Patient Experience Committees of the 11th of November and 9th of December. Anybody want to raise anything on those? No? And then finally, the North Yorkshire and York Area Prescribing Committee recommendations in November and December. No, nothing on those. Thank you, colleague. That was an expedited meeting. That concludes the business under part 1. Ryan, we can cease the recording now. Thank you. Colleagues, do you want to continue straight on with part 2?